everyone, I'm Dr. Nivedita Kaul, Senior Consultant Gynaecologist at CK Birla Hospital, New Delhi. Let's talk a bit about bleeding in early pregnancy. So bleeding or spotting in early pregnancy is very common and tends to cause a lot of anxiety or stress for the pregnant lady. Bleeding in early pregnancy does not always mean that there is a problem. However, it may be a warning sign for an underlying complication. So what can be the underlying causes or complications associated with bleeding in early pregnancy? Number one, a threatened miscarriage. Now, when a patient is having bleeding in early pregnancy and she has a scan and the scan shows us that the pregnancy is progressing normally, that is, on scan we can see the small fetus with a heartbeat, then this situation is called a threatened abortion or a threatened miscarriage. In most such cases, the pregnancy will continue normally. Sometimes bleeding in early pregnancy may be associated with a miscarriage. Sadly, the ultrasound might show us that the pregnancy has already miscarried, which means that the pregnancy is not okay. Early miscarriages are actually very common. Statistically, 1 in every 5 pregnant ladies who gets a positive pregnancy test will go on to end up in an early miscarriage for no apparent reason. But the good news is that such miscarriages are usually a one-off or a chance event, and the chances that the pregnant lady will have a subsequent next normal pregnancy are very high. Sometimes 1 in 100 cases, bleeding in early pregnancy, especially if it is accompanied by pain in the lower tummy, can be a sign of an ectopic pregnancy. What is an ectopic pregnancy? It means that the pregnancy, instead of growing normally in the womb, is actually growing outside the womb, most commonly in the fallopian tube. This is a condition which is diagnosed on ultrasound and then managed accordingly. So if you're having bleeding or spotting in early pregnancy, you will contact your gynecologist, who is most likely to advise you on ultrasound. The ultrasound will then guide further management. If at any time in early pregnancy you are experiencing heavy bleeding with clots, you are having fainting or dizziness accompanied by severe pain in the abdomen, you must contact the emergency immediately. Thank you.